Hello, everyone. My name is Michelle Lopez, and I will be talking about reproductive vaginal cancers. What is vaginal cancer? It is a rare cancer that occurs in the vagina. Commonly occurs in the cells that line the surface of the vagina. It is a disease where malignant cancer cells form. There are two types of vaginal cancers: squamous cell carcinoma and adenocarcinoma. Type 1, squamous cell carcinoma. Common of the two types. Happens when cancer forms in the flat and thin cells that line the vagina. This type spreads slowly and stays relatively close to the origin of where it starts. These carcinoma cells have the ability to move to other organs, including the lungs, liver, or bones. Most common in women older, with nearly half of all cases occurring in women aged 60 and up. Type 2, adenocarcinoma. Starts in the granular cells that are located in the lining of the vagina. These cells make mucus and other fluids. This type has a higher probability of spreading to other areas of the body, which include the lymph nodes, which are designed to help filter harmful substances in the body, typically located in the groin area and lungs. A rare form of adenocarcinoma includes the clear cell carcinoma found in mothers who took hormones called diacylbedestrol, DES, in the early months of pregnancy during the years 1938 through 1971. This medication was prescribed to prevent miscarriages, but stopped being used in the year 1971. Without exposure to DES, clear cell carcinoma is likely to happen after menopause. Risk factors: cervical cancer. Women who have cervical cancer or vagina precancer have an increased risk of vaginal squamous cells. Smoking. Smoking cigarettes doubles a woman's chances of developing vaginal cancers. Age. Women ages 60 or older are found to have squamous cell cancers of the vagina, which can occur at any age, but is less likely to occur in women 40 years and younger. DES, as previously mentioned, is a hormone drug that was used between 1938 and 1971 to help prevent miscarriages. Mothers who took DES developed clear cell adenocarcinoma of the vagina more often than normally expected. And fifth risk factor is HPV, otherwise known as human papillomavirus. Vagina cancers and HPV. HPV is a group of virus that is able to attack cutaneous and mucosal tissues. HPV that attacks mucosal tissues are the ones believed to induce vaginal cancer in the vagina. There are certain persistence types of high risk of HPV, which include HPV 16 and HPV 18. Low numbers of carcinogenic types of HPV trigger the formation of malignant carcinomas and tumors in the vagina. However, high-risk HPV may not produce visible signs until precancerous changes begin to occur. Symptoms: early vaginal cancers may not cause any visible symptoms and signs. With progression of vaginal cancer, symptoms progress. Symptoms associated with invasive vaginal cancers include abnormal vaginal discharge, a mass or lump in the vagina that can be felt, abnormal vaginal bleeding, frequently following sex, pain during sex. Symptoms associated with advanced vaginal cancers, which is a spread beyond the vagina to nearby organs and structures, include painful urination, constipation, pain in the pelvic or lower belly, back pain, and swelling in the legs. Treatments for precancers include laser surgery, which consists of a beam of light used to vaporize the abnormal carcinogenic tissues and large lesions of abnormal cells. Topical therapy medication put right onto the affected areas is another type of treatment. Fluorouracil acid is a chemotherapy drug that is applied directly to the lining of the vagina. This process is repeated weekly for 10 weeks or can be given nightly for 1 to 2 weeks. Warning though, this treatment can cause severe vaginal irritation. An imiquimod is a cream that is applied to the pre-vein and is not a chemotherapy drug. It acts by boosting the body's immune system to the area of abnormal tissues and may be used once a week for 3 to 8 weeks. Treatment for invasive vaginal cancers include radiation therapy, which is a treatment often used for vaginal cancers. It involves using high energy rays, usually gamma rays or X rays, or particles such as electrons, protons, or neutrons to kill cancer cells. Surgeries is another treatment usually only used for small stages, stage 1 or stage 2 of vaginal cancers, or for the cancer cells that were not eliminated with radiation. The extent of surgery depends on the size, location, and stage of the cancer. Types of surgeries include the local excision, which is cancer is taken out along with nearby edge or rim of the normal tissue. A vaginectomy is a surgery of the removal of the vagina. Partial removal of the vagina is called partial vaginectomy. Hysterectomy is the surgical removal of the uterus, cervix, and part of the vagina. Tracheotomy is the surgical removal of the cervix. And lymphadenectomy is the surgical removal of lymph nodes. Preventions. Best way to reduce the risk of vaginal cancers is to avoid the risk factors. Avoid HPV infections by using condoms and receiving HPV vaccines. Avoid smoking. Get regular pap tests and pelvic exams by a doctor. And treat any vaginal precancers as soon as possible. Incidence and prevalence among different ethnic and cultural groups in the United States. Black women are diagnosed with HPV-associated vagina cancers more than any women from other races. White women had a rate of 0.4 with 681 cases. Black women had a rate of 0.6 with 126 cases. American Indian Alaska Native had a rate of 0.3 within 5 cases. Asian Pacific Islanders had a rate of 0.2 within 23 cases. Non-Hispanics had a rate of 0.4 within 766 cases, and Hispanics had 0.4 rate within 80 cases. References used in this infomercial today to gather this information came from the American Cancer Society, Centers for Disease Control and Prevention, Vaginal Cancers, and Human Papillomavirus. And this concludes my infomercial on vaginal cancers. Thank you guys all for watching, and have a great day.